Chemo-induced peripheral neuropathy, it refers to nerve damage that can occur from commonly used chemotherapy agents that are used to treat cancer. The nerve damage can make the nerves, especially in the fingers and the toes, the hands and feet, to dysfunction and activate when they normally wouldn't, and it can cause them to die back and not cause sensations when you would normally feel them. So for example, normally when we touch something, you'd feel that when you touch it, but if someone has chemo-induced neuropathy, they might not feel anything. It occurs in about 2 out of 3 patients who get chemotherapy agents that are so-called neurotoxic, which is many of them. And for about half of people, it will go away, and for the other half, it might take months or years to go away, if it goes away at all. It's really bad because it stops people from doing everyday activities like buttoning clothes, texting, writing, also walking, and it compromises people's balance, increases risk of falls, causes rehospitalizations, and increased medical expenses of upwards of $20,000 for a patient with chemo-induced neuropathy compared to a patient with cancer who doesn't have chemo-induced neuropathy. When I read the literature, I noticed that most of the work done was on peripheral nerve damage, and I have a background in psychology and neuroscience. I love thinking about how the brain processes what's happening in our bodies, and I knew there was a gap there. And I thought that if we could better understand the role of the brain in chemo-induced neuropathy, that could help us better prevent it, treat it, and predict it. Because the work that's been done so far has been good, but not good enough, because patients still don't have established treatments or prophylactics for chemo-induced neuropathy. We've conducted several studies suggesting that home-based daily walking and resistance exercise can help partially reduce symptoms of chemo-induced neuropathy. And there could be several reasons for how that happens. We think that exercise can help reduce inflammation, which could reduce the nerve sensitivity. Exercise can help the brain by supporting beneficial activity patterns and connectivity patterns within the brain, which we know are altered in chemo-induced neuropathy. Exercise can help people feel more comfortable in their bodies so that even if they lose sensations in their feet, because they keep practicing their walking every day, their body and their brain knows how to use their body despite the limited sensations that they're receiving. Our work with exercise suggests that people who are exercising more before their chemotherapy starts actually have less severe neuropathy symptoms. And it might be because their bodies are healthier and can receive that chemotherapy and deal with it and reduce those toxicities before they get too bad or before they even start at all. In order to treat chemo-induced neuropathy for patients who already have it, exercise, like we talked about, might help allow them to not fall over if they lose their balance. If you can't feel your feet, if you keep walking every day, your brain and your body can learn how to maintain your balance, even if you can't feel your feet as well as you used to. One of the most exciting ideas that we're pursuing in the lab is the idea that there is a false dichotomy between physical therapy and psychological therapy. We know that exercise is great for strengthening the body, but we don't know as much about how exercise can strengthen the mind. If we keep pursuing this research, we want to make transformative, new, paradigm-shifting, exercise-based interventions that are as good at strengthening the mind as they are at strengthening the body. We usually think about the mind as supporting thinking, feeling, perceiving, and remembering, but really the mind is more than that. It creates the entire universe as we know it. And I think that if we can better understand that process of how the mind creates the world as we know it, then there's really no limit to what we can achieve.